has been a champion for healthy communities for over 15 years and currently serves as the Executive Director for WACI Health, WACI Health, sorry. As a civil society leader in Africa, Mburu has extensively worked on supporting civil society advocacy and engagement in policy and program decision-making at national, regional, and global levels. Mburu has served in various capacities within the global health architecture, including on the UHC 2030 Steering Committee, UNITAID Communities Advisory Group, and Gavi CSO Steering Committee. She's a member of the African Union Commission Technical Group, the ALM, Investing in Health. Ms. Mburu holds a master's in public health from Ohio University, a master's in business administration from Frostburg State University, Maryland, and a Bachelor of Education from Kenyatta University, Kenya. So with that, I would like to introduce Ms. Mburu. Ms. Mburu, kindly unmute you and hire a little more about you.
Hello and good afternoon, everyone. Thank you for the kind introduction. I'm sorry my video dropped, my line actually, both audio and video dropped while I was being introduced, but I hope we will have a smooth session owing to tech issues. So shall I experience any challenges, I will request that I put off my video, but I hope it's gonna work just fine. So I have been introduced and it's a real pleasure to be here this afternoon to share, to learn, to exchange with you. My topic is on youth and health, and I'll project my slides now. I think we will have an exciting conversation. I would like that it's not a lecture, it's not a presentation per se, but that we interact, we engage, we share views. Yeah, and I think that will ensure that we all learn from one another. So I'll share my screen. Just a minute. Right, so the topic is youth and health, and specifically we will look at youth engagement and advocacy within the health sector, or in terms of making sure that there's youth participation in global health, youth participation in national health policies, and as well as making sure that as we continue to advance to universal health coverage, that young people are taking part, they are participating, they are engaging meaningfully, and we will look at what steps we can take towards that. So the objectives of this session, basically as by way of summary, is to look at how youth can advocate for change and UHC and the steps they can take towards its attainment. So that's towards attainment of UHC. And mostly we like to say making progress towards UHC. What we understand is that a country or a nation can make progress towards UHC, and that you cannot like really fully attain it, but you can make progress towards UHC, making sure that everybody is covered, making sure that the different components of UHC, that is access, equity, and ensuring that nobody is suffering financial risk because of seeking health met. Then we will look at, within this conversation as well, we will exchange views and ideas around the role of youth in advocacy. We shall also discuss the role of youth in providing a better healthcare system. We shall look at the role of youth in building and maintaining health promoting strategies in the community. And finally, how students can be effective leaders in health and develop innovative, sustainable, and equitable projects in the field of global health. So basically, as you can see, the focus is on young people, the focus is on youth, and how young people can be agents of change. So I'll go to the next slide. My colleagues have been here the last couple of sessions and have introduced some of you to Waki Health if you've attended those sessions. We are an Africa regional advocacy organization. We work to create the political will that is needed in order to end life-threatening epidemics, but also towards improving health for all. So we work on influencing political priorities through an effective evidence-driven Pan-African civil society voice and action. We are a Pan-African organization. Our head office is in Cape Town, South Africa. We have an office here in Nairobi, which is where I am based. And my colleague Joyce, who had a session with you last week, is also based in Nairobi. We also have a colleague who is based in India, Kati, who also spoke during one of the sessions. And we have colleagues who are based in Addis Ababa, Ethiopia. And our vision is health for all in Africa. I'll start by this slide, and please feel free to stop me at any time should you need clarity or to provide an input. Youth leadership and youth engagement. One of the most striking things for me, and I know for you as well, is the fact that Africa's biggest population is young. An estimated 75% of Africa's population is below the age of 35. So it makes young people the bulk of Africa's total population. But even with that, too many young people, or too many youth are unable to participate fully in society. So I think we start from that framing in terms of young people and the fact that they form the bulk of Africa's total population. But then we have a problem because a lot of young people are unable to participate fully in society. And this calls for recognition and support of youth to harness their potential. As you know, young people have a lot of potential, and I know I'm speaking to young people today, given that you're university students, and so there is a lot of potential. There's a lot of potential, and there's so much that you can contribute to society in terms of transforming, in terms of bringing the much needed change. Now, this is the basis for the prioritization of youth development by the African Union Commission through 4 key elements. Now, the African Union Commission is the secretariat of the African Union. The African Union is the assembly that brings together all the heads of state from across all the African countries. And so the African Union Commission is the secretariat of that, which is based in Addis Ababa, Ethiopia. And so they have prioritized youth within the development agenda of the African Union, which we call Agenda 2063. If you look at Agenda 2063, it has really prioritized young people, it has prioritized youth engagement, youth development. And you see Agenda 2063, right now we are in 2020. So Agenda 2063 is like 43 years from today. So what that means is that this agenda and Africa's blueprint for development, the young people who are young at the current moment, all of you, are the people who are really going to have to deliver this Africa's blueprint. Because by 2063, a lot of the people in leadership, a lot of the people who crafted this agenda will actually be long gone, unfortunately. And so we like to emphasize that Africa's future really is in the hands of the young people who are young people today. And so engaging young people, fully investing in young people, young people's potential to bring about change is an area of primary importance, and the African Union has prioritized that. And what it has done within youth development, it has 4 key elements or 4 key pillars. that outline how the African Union is investing or developing the youth agenda. So it's through employment, making sure that Africa creates more job employments for young people. It's through entrepreneurship, making sure that the environment is conducive enough so that young people can take on entrepreneurship. It is also through education, making sure that Africa's young population, which is the largest bulk of Africa's total population, is educated, and that we increase the literacy levels in Africa. And the last one is on engagement. And basically with engagement, it is exactly what you are doing here, looking at how you can get engaged in advocacy, looking how you can get engaged in shaping the global health policies, either at the local level, national level, or regional level, which means Africa region, or even global level, when we look at the global health situation and opportunities for engagement. And then finally, I wanted to mention that young people, when empowered and given the right opportunities, are effective drivers of change. We have seen this. Young people are energetic. Young people are creative. Young people are quite inspiring. They have a vision. And you all, if well engaged, well facilitated in terms of the right capacity, the right skills, you can all do amazing things. And I think that's what we need to do, given that we need to ensure that we leave no one behind in accessing health. And we need your voices. We need your action to actually make sure that that happens. So it's really about change, and young people can really be effective drivers of change. So we just started this conversation, but I wanted to invite all of us to share views, to say that what is the unique value of youth engagement in advocacy? We've just talked about why it's important that youth is engaged, why young people are important for Africa and therefore for Kenya. We have looked at, the fact that the African Union, the African leadership is prioritizing youth engagement, youth development. So I would like us to have a buzz around what is the unique value of youth engagement in advocacy? Why youth engagement in advocacy? Why is it important? What is the unique value of young people, and what do you bring to the advocacy space? So I will just request that we do this in plenary. We have a quick discussion around this before we come to the next slide, sorry. So what I'll do is I'll stop sharing and come back to all of us. I see we are 12 of us in the room, and really invite a discussion. What do you think is a unique value of youth engagement in health advocacy? What's your view around that? So Cheryl, I hope participants are able to unmute and speak, or is it only chat?
They are allowed to. They can do that.
All right. So I invite viewers. What is our take on the unique value of youth advocacy, of youth engagement in health advocacy? Are there any unique qualities, characters? Is there any unique advantage for youth engagement in health advocacy? What is your take on that? So I can go down the participants list and see if anyone would like to raise their hands or to give a view. There is no, basically this is our perspective. Like, what is your perspective about this? We have Tim, we have Simon, we have Moshai, we have Marlene, we have Kelly, Gillian, Fatma, Bonventure. Anyone to take? Yes, please. Tim, go for it. And I've noted your chat, Kelly. I'll come to that. But Tim, You have the floor, please. Tim? All right, as Tim is coming on, we have quite a bit of buzz going on in the chat. So Kelly says that recently I learned that we have a role in social accountability, that is following and educating on health guidelines, like now in Corona. Yes, social accountability is very, very, very important, which really means following on the ground, seeing, for example, where are health investments going? What is happening at the ground? Are communities actually benefiting from the health interventions? Are communities able to access health services? Are there challenges with stockouts, for example? What really is happening on the ground? It is very relevant. Social accountability is very relevant for universal health coverage, because universal health coverage, we have 3 dimensions for universal health coverage. It's really about access. Who is accessing health services? Are people able to access health services? It is also about ensuring that nobody suffers financial risk. So we shouldn't be having to conduct all forms of harambes, fundraisers, so that we can take our loved ones to hospitals, or having to sell all our belongings to raise the resources. Because when we talk about universal health coverage, it's supposed to be health that is affordable, health that is available. And that's why we talk about ensuring that people can access health services without having to suffer financial risk. And the other component is around equity. With equity, we talk about, yes, you're providing health services, but who actually are you covering? Who are you reaching? And this is where we talk about ensuring that we are leaving no one behind. There are certain segments of populations that are left behind. Do we know which segments those are? Do we know who? Look in your community right now. Take a walk into your community. Who is being left behind? Are there certain people who are not able to access health services, who are not able to reach the health facilities? Also take another walk. Go back to your village where you come from. Even if you're from town, that's still fine, but take a walk, an imaginary walk, to the nearest health facility from where you live, where your mom lives. Take a walk and tell me, how many kilometers away do your folks live from the nearest health facility? And think about not just your family, but think about the person who is really at the end of your village, and how far that is to the nearest health facility. So we are talking about making sure that we leave no one behind. And young people can be instrumental and vocal about this in social accountability. And this is what we talk about, even real-time monitoring, that you can speak up. You can say things are not okay. You can say that mama or near the border actually is not accessing health services because it's really so far away from her. We can raise our voice around that. So thank you so much for that input. We see also from Marlene saying that bringing in youth allows for fresh ideas and perspective in approaching health advocacy. And I absolutely agree. Young people are so creative. They have fresh ideas, fresh perspectives. You look at things from a different lens, a different point of view, and that is very instrumental. It's very helpful in advocacy. I'll give you an example, and I would like to give you concrete examples as we go. I know those of you who attended one of the sessions last week, my colleague Joyce was taking you through advocacy, how to put together an advocacy plan, etc., etc. So at Waki Health, we have a youth leadership program. We call it Youth Leaders for Health. It is a partnership between us and a number of other partners like Results UK, based in London, Hope for Future Generation based in Ghana, CISMAT based in Sierra Leone, and Health Promotion Tanzania, they're based in Tanzania. And so we put together our advocacy. We had a training in Addis Ababa with young people, 25 youth leaders who had gone through a rigorous selection process to join this cohort of youth leaders for health. And after they were successful in the application, the interview, and they were admitted into the Youth Leaders for Health program, we had a 1-week training in Addis Ababa, training youth leaders around different things, youth advocacy, policy, leadership, and the different things that we thought could equip them to be stronger youth leaders for health advocacy. And then we had our advocacy plan put together in January while in Addis Ababa. And then what happened? In March, Corona hit. And what does that tell you? That we had to reorganize our advocacy strategy. And that's where I'm really picking on Marlene's point. When we talk about fresh ideas and perspectives, the young people came up with ideas on how to make sure that our advocacy plan was still successful, even in the time of COVID. That even though there were a lot of plans around engaging the Ministry of Health, going to radio stations, going into the communities to mobilize for community support, a lot of physical activities had been planned for. But the young people stepped up and came up with ideas, really amazing, fantastic ideas that really made sure that we were able to deliver and to meet the obligations that we had for this project. So I really want to agree in terms of the added value and that young people and youth can bring in fresh ideas and perspectives. Gillian, you're saying youths are highly active, so they are able to put their energy into use. This is absolutely true and right. If youths are engaged at an early stage, they can make good contributions when in a position of influence. That is so right. Engage at an early stage, train young people, expose young people to policies, to the challenges, to where social justice is missing. And young people can then step in, make a good contribution and influence for change. There's also a comment, especially when it comes to projects implementation at the ground level. That is so true, that young people can easily move at the ground level. They are in touch with reality and are really able to shift things at the ground. We have Tim saying the youth tend to be more open-minded and are able to bring on board new ideas, new ways to view policy, which is absolutely true. Bonventure is saying that the youth involvement is important because they are more innovative according to modern school and technological advancement. Fresh ideas are vital in the field. A very important point there around how young people leverage on technology. The things you guys can do are just so amazing. Given the same gadgets, I don't think I could even do 10% of what you can do. And that's what we saw with the Youth Leaders for Health program that I'm referring to, that young people took the advocacy online and came up with a platform which is called the Beat Continues, and utilized the Beat Continues as an online platform to achieve everything they intended to achieve before COVID. And I'll share some of those ideas within the presentation much later. And thank you, Simon. Also, you are saying youth are the most affected people in terms of disparities in health. They have a first-hand experience and engaging them is very important. So this is very critical. And I agree with you that young people are the most affected people in terms of disparities in health. I'll give you an example. On Tuesday last week, you know which international day it was on Tuesday? Which international day was it? On Tuesday. I think, Shelley, participants are only able to chat and not speak. That's what I'm picking. But which international day were we commemorating on 1st of December? Awesome. Yes, this was World AIDS Day. World AIDS Day comes every year on 1st of December. On this day, the National HIV Program releases the national status or progress report of the HIV response in the country. I don't know how many of you saw that report or have interacted with that report or are aware of the current situation as far as HIV is concerned. So, you have the statistics, you have the data. For example, we know that right now we have about 1.5 million people living with HIV in Kenya. We also know that we have about 43,000 new HIV infections on an annual basis. So these are new infections. But I think the most striking thing is that here is a thing. Over the years, from about 5 years ago, new HIV infections in Kenya have been going down. So about 5 years ago, we had about 200,000 new HIV infections per year. It came down to 170,000, 150,000, 120,000. I remember when it was 70,000, it came down to 50,000, and now we are about 43,000. So if you look at that trend, you can see that as a nation, as a country, we have taken a dip in terms of reducing the number of new HIV infections in the country. But the most striking thing is, which is where I'm getting, is that among adolescent girls and young women, the numbers are either stagnated or are increasing. Now, I want to ask you, can you take a guess? According to that report, how many new infections are we seeing among adolescent girls and young women on a weekly basis? Type a number there. Approximately 400 maybe. So this is on a weekly basis. What do others think? 100. All right, so thank you so much for participating in that. So given that the national and overall new infection has been declining to right now we have about 43,000 per year, it is quite striking and challenging to see that among adolescent girls and young women, we are registering about 288 new infections on a weekly basis. And that is a lot. So I see the 3,000, the 5,000, the 100, the 400. So the correct figure, as per the current report, we are doing about 288 new infections amongst adolescent girls and young women. So 288 per week. It means if that number is constant, at the end of the year, you have way too many numbers. So, and that's a big question because you have to interrogate and ask yourself, how is it that the national number for new infections is going down, but not so for this one population? And this was me really agreeing with the participant who has commented in saying, that's Simon, that youth are the most affected people in terms of disparities in health. They have a first-hand experience, and engaging them is very important. And that was just one example. You could say the same about other health disparities. You could say the same about teenage pregnancies. They are on the rise, and so on and so forth. But young people, a lot of times, are forgotten. Actually, when we were talking about making sure that within universal health coverage, you leave no one behind, young people are left behind a lot. because in many cases, they are not prioritized as a priority group. I'll tell you what, in 2010, there was a study conducted here in Kenya by the Ministry of Health. It was a study looking at the health facilities in Kenya and assessing the extent to which they are youth-friendly. When we say youth-friendly health facilities, we mean health facilities that will not stigmatize young people. Health facilities where the healthcare professionals within those facilities are trained to deal with young people. Health facilities where if young people come seeking contraceptives, the first question you ask them is not like, so how come you need contraceptives and you're only 14 or you're only, so offering health services that is person and people-centered as opposed to being judgmental. And so that survey found out that only seven as in Saba, 7% of health facilities in Kenya are youth-friendly. That was back in 2010. I want to believe that that particular data set is going to be updated, but you get a gist of how things are. So if only 7% of our facilities, health facilities are youth-friendly, then you can see why young people will be most affected in terms of disparities. Because if you go to a health facility, and I'm saying this while fully aware that you are all in the healthcare profession, or that is where you are going, that is your training, that is your orientation. But you are also young people. This is the thing. And so your own experience when you go to a health facility and when you feel judged, when you feel misunderstood, when you feel like there is stigma, it is not likely, you are less likely to go back to that facility. And that's how young people behave. And so it is very true around that. So you are all right. And thank you so much for sharing this, that youth engagement is very important and it's very critical in ensuring that youth are not left behind and that we get new and fresh ideas. I want to just show you a very quick outline of some of the thoughts we have around that. So allow me to share my
Miss Rosemary, kindly unmute. We can't hear you.
Sorry, yeah, I'm trying to get the document that I'm gonna share right now. So you didn't miss anything actually.
No.
So I'll now share. Let me see, I think it's this document. Share. So you can you see my screen now? You can see my screen, right? You can see my document?
Yes, we can.
Yeah, so just I wanted to share with you these two sections here to say that broadly speaking, youth engagement can contribute to the achievement of advocacy goals by doing the following. So I'm extracting this from one of our youth engagement programs. That's why it's not in the slides. And we've said most of these things. And this youth engagement program that I'm referring to and whose strategy I'm pulling from is a youth engagement program on HIV prevention. So where you see HIV, it could apply to health, it could be applied to even other diseases like TB, malaria. So it says that taking action and collaborating within their established networks and communities to drive policy change through impacting policies and domestic investments in the HIV prevention research agenda, or whichever agenda it is. The most important thing here is to underscore that young people take action and collaborate within the established networks and communities. So what I wanted to say is that young people have like a lot of networks, that you are part of many networks, the students network, the community network back at home, so many things you're doing, even online. And so you can tap into those networks and bring value to the advocacy field. Also, number 2, amplifying young people's voices and perspectives on advancing advocacy, policy, regulatory, and many other things is very important. So we are talking about amplifying young people's voices and perspectives in terms of advancing advocacy agenda. So because young people, a lot of youth are already speaking up, not really shy to express thoughts and views and all, and that voice can be amplified to add perspectives into the advocacy field. Also developing youth interest in health advocacy and its implication on youth development agenda. That's when we engage youth in advocacy, then young people can develop youth interest in health advocacy and its implication on youth development agenda. Like, you can bring first-hand experiences in saying this particular policy, this is the kind of implication it will have on young people in Africa, or in youth development in Africa. Young people also help in keeping track of national strategic plans and policies that are set in place. So this speaks to one of them, of you, who said that the social accountability, real-time monitoring, you can keep track of the national strategic plans and policies. So, for example, I'll challenge you. Have you seen the national strategy on HIV, for example, or TB or malaria, or basically the national strategic plan on health, the health strategy in this country? So if you haven't taken a look at any of those, you can add a lot of value by looking at that and seeing what kind of policies are there, what kind of deliverables, what kind of input, what is the policy saying, and then use that to say, but what exactly is the reality on the ground? The policy is saying A, but the reality is B. But it's also very important for me to quickly highlight that, conversely, by engaging in advocacy, young people gain. So we see it's a relationship that reciprocates, that young people, you invest your time and energy and thoughts and intelligence in the field of health advocacy. But also by doing that, you gain. What do you gain? Because you get something of substance in that process. That process does not leave you empty-handed. It leaves you with you as a stronger person in leadership, in advocacy skills. It elevates your confidence levels. It expands your social and professional networks. So you get leadership development. You get a facilitated space to organize and grow your advocacy skills. There's empowerment, equipping, and capacity strengthening. There's quite a bit. Provide support to other young people, youth-led organizations that support to ensure accessible and youth-responsive health services and healthy environments, elevated youth voices, link young people and youth organizations with opportunities for advocacy in Africa. And so it's a process that reciprocates. You give in something, you take out something. And so youth engagement leaves young people with stronger leadership skills, with broader networks, etc., etc. When you get into the space, you always meet people you've not met before. You always get highlights and insights that you didn't have. So it's a relationship that you give and you take something. So I'd like to take a pause there and see if there are any questions so far, or any input so far before we go to the next thing. And also, it's been almost an hour since I started talking. And thank you because you have participated, but I would like to pause it there, see if there is any question, and so that you can also stretch a bit. So we pause for 5 minutes, questions, stretching, comments, if you want to add. This is the moment.
Also, just a reminder, you can just feel free to unmute your mic, so we can also hear what you have to say.
Has anyone raised their hands? All right, then you stretch, then we get into the next thing. Yeah, Nick is saying, raise your hand and you'll be unmuted. Nick will unmute you. Maybe I can ask a question. So far, what has been striking for you so far? What is the one striking thing so far around youth engagement and advocacy? So Nick, you could unmute Mushai. He has his hand up.
Can you hear me?
Yes, please go for it.
Oh, I'm shy. This is what I've got. This is what I think I've understood so well that I think I would like to be involved in that. You said that the cases which affect the youth, let's say HIV and STIs and all those things, they're in a higher rate in the youth. And then we come to find that in health institutions, there's a lot of stigma against the youth. Let's say if someone has ever tried buying a condom, it's so difficult in that you get to find that the amount of willpower one requires to do that, I can't explain it, but imagine our situation where a health facility, let's say half of the staff there are youths. And by youth, I mean people from 18, let's say, to 30 something. If you get that attendant is someone who's almost your age mate, it will be simpler than that old mama. No offense there, but I like that idea. Thank you.
Thank you so much for contributing and for your thoughts. You are quite spot on in saying that is one of the areas for youth engagement. One of the objectives for this session was to look at how can young people, actually medical students, I want to go back to that because it says that the role of youth in building and maintaining, the role of youth in providing a better healthcare system. A better healthcare system, which is what you're speaking to, Moshai, in saying that we are in a health system that also reflects what Kelly, I see your question, which connects also to Moshai's question. A health system that is very much influenced by traditional values, traditional systems, and also values that are also highly influenced by religious views. You see that. And also given that in Africa, we also have very diverse cultures, and different cultures come with different expectations in terms of what is expected of young people. And that can become a barrier to accessing health services. And that's why I think that young people can really be involved and engaged and offer their skills and capacity in advocacy in ensuring that we make the health systems more friendly to young people. And how you do that is really by raising your voice, is really by taking action. What kind of action are we talking about? You can write a letter. You can mobilize the entire campus to write letters to targeting the people in authority who can actually make these changes. Imagine if I was in charge of shaping the health policies within the Ministry of Health, and then one morning I wake up to 500 or 1,000 letters asking that we make the health facilities more youth-friendly. And when you do that, also offer solutions like what needs to be done, what is a problem, what needs to be done. And these are a core or basic elements in advocacy, that if you want to change something, identify what possible solutions there might be, and then approach the people who can actually make the change happen. So you have to do your mapping very well and ask yourself, if you want Kenya's health system to be more youth-friendly, meaning that you have facilities that have healthcare professionals who are trained to engage or to provide services to young people, healthcare settings where stigma for young people wanting to access contraceptives is addressed, healthcare settings where mental health is taken seriously as a health issue, as opposed to, previously, before people really understood mental health as a serious situation that needs to be addressed. People used to laugh at people with mental health challenges. And even today, there's a lot of stigma around mental health. Like we, as a society, we do not support people who are struggling with mental health issues. And so this is the kind of environment, the kind of health system that we want. And so we need to go for it. We need to advocate for that. We need to write letters to the people in charge. We need to make phone calls. You can even just call your area representatives, your elected officials, your member of parliament. They can move this thing in parliament. And they are allies in the work we do as advocates. And so there has to be a channel where we actually speak up, where we talk about the fact that we are not comfortable with the way the health system right now is in terms of it not being youth-friendly, and we can speak up around that. I see another comment, the fact that there is very minimal or close to no improvement in reduction of HIV cases among women is striking. What could be wrong? Is there anything that could be done about that? Very well taken, Gillian Faith. What that is very striking. What could be wrong? And so this is a very good question, because it also takes us to that objective around what can young people do around making sure that we address health system challenges, but also that we are active in global health. Now, why it is very difficult and striking for adolescent girls and young women and women in general, there are a number of factors that make this particular constituency much more at risk of HIV infection, starting from structural challenges. With structural challenges, we are talking about this very example we have given, that young people, once they come to a health facility and they feel stigma, they feel discriminated, they feel that a healthcare provider was rude, there was judgment, then they won't come to the facility again. There's also the issue of distance. We were talking about how far is the nearest health facility from where the rural youth are living, et cetera, et cetera. Then you come to other factors, like socio-cultural factors. And it goes back to Kelly, what you are saying, like the cultural factors, the cultural context. With socio-cultural context, you also have issues such as the gender-based violence. You have things like sexual violence, like rape, for example. You also have the patriarchy, like societies that are quite patriarchal. And you have that as a dynamic where women are expected to behave in a certain way, which sometimes compromises their ability to access health services or their ability to protect themselves from HIV infection. You then come to other factors, such as the socio-economic factors. With socio-economic factors, we are talking about, for example, the unemployment among young people in Kenya, in Africa, all over. So you have young people unemployed, but young people also need a livelihood. So you look at our colleges and universities, we know so many young people who are struggling to make a living. Maybe they don't even have access to help or to other financial resources. And what happens? They end up engaging in transactional sex, occasionally, or even as a way of living, a livelihood. And what that does, it exposes these young people to infections. Either they have multiple concurrent partners, or they have sponsors with whom they cannot negotiate for safe sex because of power dynamics and control issues, etc., etc. But also we know biologically, women are much more susceptible to HIV infection, just because of the way the transmission happens. So women are more susceptible because of their biological makeup. Young women especially, because their organs are still developing. So they are more at risk because they can easily sustain injuries, which then provide entry points and opportunities for exchange of fluids, and especially blood, etc., etc., and therefore creating an opening for HIV infection. So these are all factors. And what can you do as youth, as young people, is to really advocate and utilize your voice to look at how can change happen. There are things you can do. For example, you can be ambassadors for change by ensuring that we have youth-friendly health facilities across the country. Those things we spoke about. You can be agents of change and ensure that we have a conducive environment by requesting that healthcare professionals like you who are being trained, that are also trained specifically on how to engage young people. What are the needs of young people? When a young person comes to the health facility, what kind of experience are they looking for? What experience will determine that they don't come back or they come back to seek care? You can be agents of change. You can be vocal about that. What else can you change? You can advocate for increased resources in health. We are talking about so many young people, or even just people, whether young or not, who are not accessing health services. I think that it is unacceptable that people die because they are waiting in queue to access health facilities. You are very much aware of the cancer situation, for example, in this country. You know about the waiting list. If you have a patient, a cancer patient that wants to start chemo at Kenyatta Hospital, for example, and they go to the hospital today, how long do you think they'll have to wait for their turn as per the current waiting list? I know people who went like in 2019, 20, and they were told you're gonna be put on the waiting list and your time will, they're being given a date of 2021. And so you have people going to India, you have people going to private settings, etc., etc. We can utilize our voice in demanding for change. We can utilize our voice in ensuring that that health financing is prioritized. I don't know if you're very familiar with the different policies around health financing. Does any one of you know how much our governments have? Our government, let's talk about the government of Kenya, the national government has committed to put or to allocate for health out of the total budget, out of the total Kenya's budget, Kenya's national budget. So out of that budget, how much has Kenya committed or should Kenya allocate for health? Type the percentage there. So you have the 100%, which is the entire budget of the Republic of Kenya. Out of that entire budget, what is the percentage that should be allocated to health as per the commitments that Kenya has signed? Type a percentage there. Awesome. Look no further. So we have Bonventure saying 15%, which is true, which is right, that our governments have across Africa, because this is an African Union policy. about 15%. We also call it Abuja Declaration. It's a commitment where our governments have signed, saying that they will allocate 15% of their national budget to health. Now, type for me the current percentage that Kenya is doing at the moment. How much of Kenya's national budget is going to health? Take a wild guess. All right, so we have quite a number of guesses. Thank you so much. So we have participants talking about 15% is the benchmark. So we have participants talking about 5.1, 12%, 10%, 8%, 8%. So the 5.1 comes quite close with Raphael. We are currently doing about 4 point something. It is 4 point something, 5 point something, depending on which data source you are looking at. So you can say we are not doing more than 5% at the moment. And so we have quite a mile to go because our commitment is 15%. And you know what? Even if the government of Kenya was to allocate 15% as per the Abuja Declaration, that commitment, it would still not be enough. We would still not have enough to meet universal health coverage. And so, I mean, and I think that's a whole different topic for another day in terms of how then do we finance health in a way that is sustainable. But the point I wanted to make is that we are not keeping the commitments, and you can get involved. You can utilize your voice, your energy, your expertise in saying, can we at least make it 15%? Because if health is not funded in that way, then you have doctors not being paid, you have nurses not being paid. You go to delivery rooms, you find there's no oxygen. You know what is happening with COVID. Okay, COVID has been quite an emergency and a situation. But even before COVID, we still had very many inadequacies within the healthcare setting. And so we need to think about how can we utilize our voices now, especially as medical students, to talk about investments in the health sector. Now, the other thing that you can do and how you can contribute to better health systems is speaking up against corruption. So even though we are saying that the commitment is 15%, we are doing less than 5%. But guess what? The health sector is the mother of all corruption in Kenya. It's dogged by corruption. It's chronically having cases and cases and cases of corruption. Why? The tendering, so many things that really cloud our space within the health sector. I think that's something you can do. You can be more vocal as youth advocates, as young people, as medical students, around how we can save much more money, about efficiencies. It's not just always about additional money. It can also be about us as a country being good stewards of the resources that we already have, by being efficient, by shunning corruption. There's also a huge conversation around domestic resource mobilization. One thing for example, Kenya's national HIV response is 60%, 60 as in 60, funded by donors. So it's funded by the Global Fund, it's funded by the PEPFAR, which is a US government President's Emergency Plan on AIDS, program on AIDS. So Global Fund and PEPFAR largely financing the HIV response in Kenya to a tune of 60%. So our government is investing only about 40% of the total national response to HIV. The biggest challenge with that is that it's not sustainable because donors come and go. Donors are here today, tomorrow their priorities change and they go. There's also what we call the World Bank classification. So Kenya has moved from a low-income country to an upper low-income country, and now we are a middle income country. And what that means, when the World Bank classifies you and debases your economy, it means that some of the threshold, you don't meet some of the threshold that is required by some donors for you to qualify for some of these grants. It also means that, for example, with the Global Fund, when Global Fund gives a grant to Kenya, it also expects Kenya to put on the same table a particular amount. So when you're a middle income country, the amount you're expected to put on the table is much more than is expected of low income country. What does that mean? It means that there are more financial expectations for us as a country into the health sector now because of our income classification by the World Bank. You can utilize your voices around this issue of financing. You can talk about the issue of debt. This week, Kenya's debt has hit, I'll get you the actual number. It's quite a mind-boggling number, but Kenya has hit a very serious debt rate at the moment. You know, when COVID-19 happened, a lot of countries in Africa chose to respond to COVID-19 by borrowing because there was a reduction in revenue. And so countries did not necessarily have resources because our health systems were already weak. So the debt that we have accumulated in Kenya and many other countries across Africa, they have far-reaching implications because it means that our ability to invest in health is limited, because you know what happens with debt. When we have our tax revenue in the country, before you make any payments as a country into paying salaries or buying commodities as a country, the first thing you have to do is to repay your debt. And so the first check that Treasury writes is around debt repayment. Yes, Raphael, thank you so much. 7 trillion. I was looking for that figure. 7 trillion in debt. So you can imagine far-reaching implications. And you've been reading the news. How is the government planning to manage this debt? You saw, by cutting hundreds and hundreds and hundreds of jobs. It's very serious because the moment we get higher in unemployment, it means that we have many people who will not be able to access health services because livelihoods, economic contraction, you know, all these things come to play. And so you go further and further and further from universal health coverage, because it means that we will be paying out of pocket because, you know, you won't be aligned to any insurance, you know, you won't have a job. And so I think it can really affect out of pocket expenditure, which is an expenditure that pushes people more into poverty. And the more people get into poverty, the harder it is for them to access health services. So there's so much for us to think. And so as young people, as youth who are interested in shaping the global health narrative discussion, in contributing through advocacy to ensuring that our countries make progress towards universal health coverage, there are so many issues that you can take up, that you can speak about. We have mentioned a lot of them, and you can figure out how do you frame them. You can approach organizations that work on advocacy to see how they can support you with the letters, with the talking points, etc., etc. There's so much that can be done and can be achieved. Are there any other questions at the moment? Or any other contribution? So I will go ahead and finalize my slides. We are almost done now. I wanted to speak about, so I'm sharing, I guess, to just speak about all these things that we are talking about in terms of advocacy. You can approach this And this is how we work at Waki Health. We have a Pan-African approach where we coordinate across continents, across organizations. So this is important because if you have identified issues that are pertinent to you and you want to take them up as students, you could take them forward through a Pan-African voice. Is there an Africa Regional Students Body Association network? What issues are they pushing forward? This is important because you see, like the 15% Abuja Declaration, even though Kenya has not met, many other African countries have not met. So you could have a regional agenda with the other medical student associations across Africa and move that agenda at a regional level, but also think about, do you have student networks or associations across the language regions? So looking at Anglophone, looking at Francophone, this is one way we work. So we have counterparts in Francophone region. So when we engage in this kind of advocacy, we make sure that the Francophone region is also covered. It strengthens our advocacy, and it makes sure that the African Union heads of member states in the Francophone hear the same message that we are sending to the Anglophone. So it speaks to the power of partnership, the power of working together, the power of utilizing a coordinated approach in terms of voice and action. But we also work at country level. These are just examples. So this is thinking, yeah, we are here today as Medical Students Association of Kenya, and this kind of network, you have it in different other countries. Maybe you could find interactive advocacy engagement or an exchange with a similar, your counterpart in Malawi, in Zambia, and learn what are your colleagues in Zambia doing, what are your colleagues in Malawi doing, etc., etc. And I know you are connected to these networks. So that's another thing to look at. How can you promote a South to South kind of learning? What are your counterparts doing? And maybe you are already doing this. Now, these are examples of some of our advocacy work we have done with the youth engagement program. So when COVID-19 hit, I was telling you about the Youth Leaders for Health program. They came up with what we call the Beat Continues. You can see the Beat Continues logo right here, which was a platform for young people to engage and social distance, engage online. So the Beat Continues is a platform that mixes culture, which is drum beating, brings technology in there because it was an online platform, but also brings policy in there because young people were using the drum beat, so they would drum to draw attention to the policymakers, and then they would have their message, and then they would send that video to a policymaker and say, we had 3 key messages, which were around. The first one says that to defeat COVID-19 and safeguard critical fight against HIV, TB, and malaria, additional domestic and international funding is concerned. So there was one about resources. There was another one about ensuring that the response addresses gender barriers, stigma and discrimination, and protects human rights. And the other one was saying that the world must unite in order to fight, in order to defeat COVID-19 and protect progress against HIV, TB, and malaria, as well as save lives. So the young people came up with these messages. They came up with the concepts of the Beat Continues. They utilized drumming across the region. So drumming was happening in Senegal, in Kenya, in Sierra Leone, and actually these young people also mobilized colleagues across in different continents. So we had people joining us from India, people joining us from the UK, people joining us from the US. And what was happening is that people were just drumming, taking a video while drumming and speaking the message and directing that to a policymaker. So that's just an example of how young people got engaged. And we got the attention of the African Union. They recognized the Youth Leaders for Health. In fact, we got a letter from the Deputy Chair of the African Union Commission. thanking these 25 young people for being brave, for engaging and coming up with an organized advocacy plan and platform during COVID-19. We got the attention of the different ministries of health from Ghana and different key influential people who responded to our campaign that was being led by 25 young people. And so this is just an example of what happened. And when you look at this image also, one other key thing that stands out is that it's very important to harness partnerships. Now, Youth Leaders for Health, the 25 young people who came together and did this, they did better because they partnered with other organizations, GFAN Africa, Civil Society for Malaria Elimination in Africa, Africa Coalition on Tuberculosis. So partnership is also very important in your advocacy. So these are just sample activities of what the young people we are doing, the ones we are working with, Youth Leaders for Health. So they've been running webinars. On the webinars, they've had various forms of webinars where they have webinars like what we are having today to educate ourselves, to get information. Then they have webinars where they invite the policymakers. So on the webinar, we would have many people from the Ministry of Health, they would have members of parliament, they would have people from the African Union coming to the webinars, so that this is now a dialogue between the youth and the policymakers and parliamentarians. We had publications in mainstream media and online. We also created a show, it's online, we call it VUCA Africa Show, which is something we created as Waki Health to continue the conversation. You will see the link to that. Then the young people actually sent many, many letters to ministers of health and ministers of finance. Now, articulating the issues we were talking about, the issues of financing, the issues of efficiency, the issue of making sure that as we respond to COVID-19, we are not forgetting that people are still getting infected with HIV, with TB, with malaria. People are still dying of other conditions and diseases. Also, we had dialogues with parliamentarians online and media engagement, mainstream and social media. And young people are extremely talented when it comes to social media. So this is an example of some of the work. These are just a sample of articles, publications, videos, and the shows. So we have partners from across the region. Some of these are the articles we published in the newspapers, in English, in French. Our colleagues in different countries coming up, a young person featuring in the VUCA show to speak about youth engagement, and so on and so forth. And then this is specifically social media. So what we just looked at was really like print articles in the newspapers. And then this is the social media. So we did a lot of what they call the Twitter storms, the Twitter storm, Twitterthon. They would identify like World Malaria Day. They would block like 2 hours and say, today, nobody's going anywhere. We are going on Twitter. We're going to have a Twitter storm. And they would say, okay, today we are tagging so and so and so and so because we want their attention. And it's just amazing how they utilize social media to get the attention of policymakers. So these are just ideas. And so going forward, there are also quite a number of work that is going on, whether it's making sure that we have open editorials. So that is where you write an opinion, you send it to your newspaper editor, and they publish it. So we do that a lot. We have forged partnerships with media houses, with editors, which really is helpful in advocacy because you need to get your message out there. We have been creating videos, reaching out to people to create videos that can capture community voices for dissemination. So for example, as a students association and students, it's very easy because you just use your voice, your phone, and you agree on what is the message that you want. What is the advocacy issue that is keeping you awake at night? What do you want to change? And then you can mobilize and rally yourselves together. You just need like 10 of you or even 15 of you as you are on this call. You create videos and then you disseminate them online, you tag the people who can make the change. It's so much like the student activism in college and university, how you do that. It's quite similar also to how we do it in advocacy. We also train journalists so they can better understand our issues. So those are just examples. And we are doing the same thing with our Francophone partners. So we like to ensure that what we do in the Anglophone region, we also want to make sure that it appears in the Francophone region as well. And so in terms of us, I had actually mentioned this, our social media platforms, our main offices in Kenya, South Africa, and Ethiopia. So this is a presentation. There's so much more that we can discuss, but I want to leave it here and see now if there are any questions, views as we head towards closing. Are there any questions? Something I didn't cover and you are expecting to gain more understanding and clarity of? This would be the time, or any reflection on the materials or content that has been presented so far.
Thank you so much, Ms. Rosemary, for that very educative presentation. Mine is a question. I'm just wondering if when the letters were sent earlier on in the year and the policymakers were identified and communicated with, was there any change in how did they make any changes in the policies?
So that's a good question, because it also delves into the question of how soon can a policymaker change or influence policy change. So because policy takes a long time to change, for you to change a particular policy, whether you want a new inclusion or you want an amendment, or you want to influence the implementation of an existing policy, it's a process that can take a while. So what you do in advocacy, especially in policy advocacy, is you come up with milestones and you tell yourself, because the thing you want to influence can take even a year before you see, you come up with incremental milestones, little by little. So what you might want to do for the first 3 months is to say, I want the attention. I want to get attention. I want to raise this issue. I want people to know that there is an issue. So what you do is, so your first kind of engagement with the policymakers, you're actually educating them about the issue. Your goal is to say, like, they have to know that there is this problem. And so you embark on awareness raising, you embark on getting them to understand that, the adolescent girls and young women are really getting disproportionately infected. So you take the issue out there. Then when you do that, you are also saying to them, what we can do about this issue is that we can make sure that we have youth-friendly facilities in Kenya. So it's part of the conversation. You highlight the problem, then you begin to present solutions. This is what you can do. Now, how we measure whether we are making progress at this time, it's not necessarily that the policy has changed or that the health facilities now have a youth-friendly policy or they have trained the healthcare professionals. Those ones are important, but they will come further down the line because it's a process. What you want right now is to see, do you have buy-in? Do they appreciate that there is an issue? That's where you begin. Number 2, do you have a buy-in? How do you know you have a buy-in? And what we do is to make sure that if you're targeting, for example, the Ministry of Health, you have to be very strategic. And what you want is to have them speak in public about the problem. So you want your member of parliament, or you want your Minister of Health, or whoever the policymaker is. One of the measures is that if they can acknowledge in public that this is a problem, then that can show you, it can be an indicator that you're moving in the right direction. How do you get them to speak about these issues in public? So you have to be very strategic. You have to know, where is there a national event where a person who matters, a person of influence is going to be speaking. And then you have to utilize your networks, identify who can you speak to, who can influence that person's speech. So, and this is where partnerships and networking come in, because you need to reach out and say, I understand that so and so is going to be speaking during the World TB Day. Can we contribute some talking points to their speech? So you actually ask. Advocacy is very much like, you need to push, you need to be very strategic, you need to be very tactical. You need to know, where are the opportunities? When are they speaking? Where are they speaking? Who is writing the talking points for them? And you slide in your talking points. This is important, because the moment they start talking about it in public, the moment the issue gains momentum, and the easier it is for it to be implemented. So we call it making noise, actually. I would say quote unquote. We say, like, you have to make noise about it, and the noise will be heard. But it's not just making noise for the sake of making noise. We call it strategic noise. You have to know, who are you speaking to? Where are you raising the issue? Are there people who matter? And even before you get that, you have to do your mapping to say, who actually matters in this situation? Who is important, and how can I reach them? Now, if the person who matters, if you don't have access to that person, say that the person who can make this change is a Minister of Health, for example, and you don't have access to them, you have to map out and say, who do I know that knows someone that knows the minister? So you have to map out your network. So if, for example, you are a student organization, you want to reach, you have to say, okay, does Waki Health have a relationship with the Ministry of Health? Yes. Who within the Ministry of Health does Waki Health know? So and so. Does that person have the power to make a decision? No. But does that person know who can make the decision? So you do your homework, you do your power mapping. So wanted to just share that in response to your question. Thank you so much for the compliments. I appreciate that. It's also been very, very, very exciting to see you participate, provide input here and there. But don't go with any question. If you have a question, if you're asking entry points, where can you get engaged? Do let me know. So at Waki Health, we run 2 youth programs. We have the Youth Leaders for Health. We also run what we call AFNI Youth Cohort. So AFNI Youth Cohort is Africa Free of New HIV Infections. These are young people who are interested in utilizing their voice, their energy, their expertise to really impact and influence HIV prevention research. So we have those 2 youth platforms. I know there are also other student advocacy networks, so it would be very good for you to connect with a network, an organization that is doing advocacy, where you can actually also contribute. And Cheryl has our contacts, has our email, so just shoot us an email in case you have further question, or in case you'd like to be engaged in the youth programs, the youth advocacy work that we are doing. You can also feel free to go to our website, and there there is a specific section on youth leadership and youth engagement. Let me just share a bit so that when you go there, you will not be lost. So if you go to our website, which is www.wakihealth.org, then if you come to what we do, let me see, what we do, you can come to movement building. When you come to movement building, you go all the way and you'll see youth engagement. Now, if you click youth engagement, it will take you to the 2 youth platforms that you are working on. So there's the the Youth Leaders for Health, and there's the AFNI Youth Cohort. So if you click there, you'll see more of the work. This is the Youth Leaders for Health program and all the different work. So these are young people that we work with, speaking up, utilizing their voice. So for example, but anyway, I might not have voice, but these are young people. So anyway, we don't have time, but go there, check it out. There is also the other network. If you go back, you come here, you can come here to the youth cohort and also see what is the youth cohort doing, what kind of activities exist. So feel free to reach out to us and see what opportunities exist for your continued engagement. So I think, Cheryl, we can leave it there unless there are any additional questions.
Thank you so much, Ms. for that very insightful talk. I personally feel very energized and we need to take on the world. So yeah, so I think we'll just give a few minutes to see if any of the participants has a question. So kindly raise your hand up so that we can acknowledge you and have that answered. A question or remark or suggestion. Let's hear your voice. Okay, so not see any other questions. I really don't leave anyone out. Okay, so thank you so much everyone for attending this session. And thank you, Minguru, for giving us your expertise, sharing your expertise and experience on this. And I'm really grateful that you took the time to come and to our event. And yes, I will I think you can share your email if you don't, so that if any of the participants would like to speak to you. Is that okay?
Sorry, I didn't hear you. Your network was
Oh, sorry, I was saying that maybe you can leave your email in the chat box so that if any of the participants are to choose.
Okay. Yes. Okay. And I will send you the presentation so you can share.
You can be able to. Okay, yes, that will be there. So she sent an email. It's rosemary@wakihealth.org. So if you have any questions today or you'd like to be engaged in one of the project going on, you can send an email. And so finally, if no one has a closing remark, we can just listen from Rosemary. Do you have any conclusion?
So that's me.
Do you have a closing remark just before we end? Like,
sorry, your line is breaking so much. I can't get you. Maybe it's my end. Let me close.
Have a closing remark before we close. Okay. Can you hear me now? Oh yes, closing marks.
All right, sorry. Thank you for clarifying. I hope you can get me because maybe it's my end. But I want to thank
We can get you
so much. I want to thank you so much, even for organizing this as young people, as youth, as students, but also for including a conversation about youth leadership in advocacy and how you can be better engaged and how you can sharpen your skills and how you can really participate in policy change. So this is really exciting. And I want to encourage you to continue doing that. See how you can better organize yourself, how you can continue to tap into experiences and expertise of people like us who've done this for a while. So this is what we do. Our organization is basically an advocacy organization. We focus on health advocacy, global health advocacy. And for us, there isn't greater joy than seeing young people who are taking it up, who are speaking up, who want to better their craft in advocacy. So this is just so amazing. Keep going. I really wish that you can stay connected. Let us know how we can support with your engagement, with strengthening the skills, etc., and how we can collaborate, how we can partner. So do not hesitate to reach out either as a network or even at an individual level if you have interest in learning more about this. So I want to thank you very much, and let's do it. I think the bottom line is everybody has a responsibility of contributing to making sure that nobody is being left behind when it comes to health services, and that any person anywhere in this country should access health services regardless of their age, their background, where they come from, who they are, and they should do so without suffering financial risk, which means without having to sell all your property for you to go to the facility. I thank you very much and I wish you well.
Thank you, Mrs. Mary. I'd like to ask one participant to just unmute. So be it, I'll ask Nicholas, kindly give a remark as we close. Nicholas, can you hear me?
Yes, I can hear you. Sorry, I give a remark.
Yes.
All right. Thank you, Ms. Mburu, for finding time to come and offer this open access session. It's really important, especially to know how the youth can get engaged in advocacy work. And it has been really insightful, even for me and other leaders who are in this call, because even though we are already maybe leading student organizations, we have not engaged so much in youth leadership, and I think youth advocacy, and I think that is a very fundamental area for the youth to pursue, and that is something that we should take up after this GA to make this session impactful. So thank you so much for finding time, and we look forward to engaging you more in our activities.
Thank you so much. Asanteni.
So I think if no one has anything to say, and once again, thank you all for watching, and I'll be sure to catch to check the recordings of the health policy and advocacy workshops that took place last week. You will find them on YouTube on MSAKE page. Yeah, and they'll be very helpful to you. So yeah, without further ado, I think we can just end the meeting. And thank you guys so much for attending today. And
Awesome.
have a lovely.
Thank you.
Thank you. Could Rosemary and Cheryl please remain behind for a bit for a photo?
Okay.
I will not be on the photo. Yeah. Okay.
Why?